Good.
How are you?
I'm doing well. Fred, we have you back today. Yes. All right. You guys are taking turns. That's good. I like that. That's good cooperation. We got good social distancing back there. All right, physical distancing. Great. Thank you very much for coming in here this afternoon. As part of our efforts to continue to update people with regard to where we stand with regard to the coronavirus, we're having these weekday press conferences at 2 o'clock. So thank you all very much for showing up. I want to thank all the Nebraskans who are continuing to work to slow the spread of coronavirus here in our state and all the great work everybody's doing. How almost universally people are paying attention to the 10-person rule. And again, this is about limiting those public gatherings to 10 people or less so that we can slow the spread of the virus here in our state. And I really appreciate everybody doing that. And of course, I want to remind everybody, we need to continue to keep that distancing, that physical distancing from people when you're out in public. You know, that 6 feet from each other, and also all the other good hygiene practices that we have. Make sure that if you are symptomatic, you've got a fever or a cough, stay home. And especially if you're in the Omaha area, everybody else in your household needs to stay home too if you are exhibiting those types of symptoms, or if somebody in your household is. You need to stay home. Make sure that you're keeping your distance from people who you can see are sick. Make sure that you're washing your hands often and doing it for 20 seconds at a time, that you're coughing into your elbow or a tissue, that you're not touching your hand or your hands to your face. Those are the types of things we can all be a part of to help slow the spread of the virus here in our state. So thank you very much for everybody participating in that and making sure we're following those rules about how we slow that spread. So today I've got a number of guests with us here this afternoon. I've got Steve Nelson, who's the president of the Nebraska Farm Bureau, the largest ag group in our state. Is that right, Steve?
Yes.
Yep, right. Steve Wellman, who is our director for agriculture, and they'll be talking a little bit later in our program. I've also got with me the two CEOs of two of our hospital systems, Cliff Robertson from CHI and Russ Grunwald from Bryan, to talk about some of the things they are doing to help address the coronavirus here in our state. Before we get to that, though, I want to talk about some updated guidance that we have from our Department of Health and Human Services. That what we are doing is taking the guidance we've already put out there and updating it and clarifying it. And specifically, what I want to do is make people aware that if you are a traveler and you have been traveling internationally to places where we know there are high incidences of coronavirus, places like Europe or Asia, when you return back to Nebraska, you need to quarantine yourself for 14 days. If you're a domestic traveler and you're going to places where we know there is lots of coronavirus community spread, you also need to quarantine yourself for 14 days. And when I say areas we know have coronavirus, I want to specifically talk about New York, San Francisco, Seattle, those types of areas which we're very familiar with, but also places like Denver, Kansas City, Chicago, places that will be closer. Now, if you're doing any of that out-of-state travel, you get back to this state, quarantine yourself for 14 days. Now, if you are a commuter, somebody who, say, commutes back and forth between South Sioux City and Sioux City, or Council Bluffs and Omaha, or Cheyenne and Scotts Bluff, you do not need to quarantine yourself for 14 days. We're not including commuters in that, nor are we including transportation workers. If you're a truck driver and you're crossing state lines as part of your regular job, you do not need to include yourself as part of that. Now, if you are a healthcare worker that is traveling out of state, when you return back, please consult the medical professional at your facility to talk about a process and procedure to make sure you're preventing exposures through your work. So we ask you to reach out to your medical facility to talk about how you can limit that exposure if you've been out of state. So that's updates to our policies there. I also want to highlight that it's Ag Week, and actually we're going to do our proclamation when I get back to you guys there. But it is Ag Week here in Nebraska, and we'll talk about that in a little bit. But now for a second year in a row, Ag Week has really been preempted by a disaster. Last year was the flooding that we had here in the state, and this year's the pandemic. But I really want to say we are so grateful for all our farmers and ranchers who are feeding the world and continuing to work to be able to make sure that we have strong food supply chains here in our country. So we'll be talking about that in a little bit as well. Some other issues I just want to touch upon before I turn it over to our CEOs is, one, testing. We are continuing to work on expanding the testing. We talked about this a little bit yesterday. Today is the first day that we are pooling samples in an effort to be able to expand testing capacity in our public health lab and also be able to help us conserve those reagents. So today is the first day that we're doing that. So we're very excited, and we're going to see obviously how we can continue to expand that. We are also seeing private lab capacity expanding. Yesterday, we received over 100 lab tests back from those private labs. So that's an important aspect for how we will expand testing capacity here in our state, is when those private labs are expanding. So that's a key thing. Again, you'll recall we talked about some of our capacity. Yesterday, we received over 100 lab tests back with regard to coronavirus from those private labs. We have also been made aware that there are scams going out there on the internet and other places with regard to donations. So again, whenever there are people who will take advantage when we have an emergency like this, they will run scams to say they're raising money for some charity, and then obviously they're not delivering the money to that charity, or the charity's a fake. So we ask you, please make sure if you are contributing to a charity that is supposedly helping out with the coronavirus emergency, make sure it's a trusted source. Make sure it's a trusted charity that you are donating to. That's very, very important. So that's a big key. And then finally, this afternoon, I will be doing a Facebook Live event with people from our business community to be able to talk about the coronavirus and answer questions. So that will take place at 4:00 p.m. today. Again, another part of our efforts to be able to continue to make sure we communicate with folks here in Nebraska about how the coronavirus is impacting them. Now, with that, I'm going to go ahead and, Russ Gronwald. That's what I'm thinking, like, which two of I did say I was going to introduce first? It's Russ. I'm going to introduce Russ Gronwald, the CEO of Bryan. He's going to talk about some of the great things that Bryan has going on to be able to help address this emergency with the coronavirus. Russ?
Thank you, Governor. I am going to just spend a couple of minutes talking about some initiatives that we have going on, some examples of what we're doing today. One of the things, of course, that's most important is not just taking care of our current situation, but planning for any surge that could happen. We hope it doesn't happen, but we need to plan for that. And we know that when you do that, the two things that happen most quickly, you run out of places to go. So we have to free up beds, and we've done that already. Working collaboratively with CHI St. E's here in Lincoln, as well as Lincoln Surgical Hospital and others, to cancel elective surgeries effective tomorrow. So pretty much all elective surgeries in this particular area, following the lead also of what Omaha had done previously, are canceled as of tomorrow, and we're working through, of course, all of the specifics around that. The second thing that you start to see a shortage of in any hotspot is that of ventilators. And we know that ventilators become a premium when you get into the latter stages of care for a COVID-19 patient. One of the things that we had happen recently is we were replacing out some aging anesthesia machines, about 34 of those, when our director of surgery said, you know, these actually have a ventilator-like capacity built into them. What if we kept them and converted them over? And so, in fact, that's what we've done. We've already converted half of those 34 machines over by essentially separating the anesthesia portion from the ventilator portion. You take out the gas cylinder and the gas tubing, and you put a HEPA filter in, and that's the short version of how you do that. And we now have 34 additional ventilator machines. That, coupled with what we had and some donations we've received, has allowed us to get to over 100 ventilators now, almost double than what we had previously. And we've also figured out, I think many have figured out, but we've also finalized the protocols for, if we really came to it, being able to vent multiple patients off of the same machine. So it really does give us much more capacity than what we had in the past. Also, I know there's been a lot of discussion for a long time about drive-through testing. Just a few minutes ago, we opened up a drive-through test at our south location on 27th Street at our LifePoint campus. So these are folks that have a prior physician order and referral for this kind of testing. It's not a show up at will. It already has to be somebody that's pre-screened and has an order from their physician, or has gone through our Easy Visit online test, in which case they can also get a physician order through that. Those are pre-scheduled. We're going to be starting with about 60 a day from 2 o'clock in the afternoon to 6 o'clock, so 15 an hour until we figure out how this ramps up. But we really think this is important for the public, for them to be able, for those persons in that particular situation, to get on the right course of treatment. Finally, we're spending a lot of time with our rural partners. One of the things I've learned about working with rural facilities and CEOs and communities over our years is that folks in rural Nebraska do exactly what you expect in a crisis. They don't run away from it, they run right to it. And so we have been working with about 50 rural facilities through what's called the Heartland Health Alliance. It's a consortium of rural hospitals, most of them small rural hospitals, to figure out what their plans are during this crisis, to figure out, do they have the kinds of supplies that they need? Do they have the kind of training that they need? And they're very forward-thinking on all of these things. And when we've been surveying them, they've said, we plan on keeping as many of these patients as possible until they get to the point where they need 24/7 ventilation. So we are working with them on what our transfer protocols would be, how they do that, and how they train folks, how they keep their folks safe, what is the messaging to their community, all of the things that they're going to want to do to take care of those folks in place. Some of them have more capabilities than others, but that's what we're working on right now, is to make sure that when they get ready to transfer to Bryan, they've done everything that they need to do to take care of that patient the best that they've been able to into that community. We also are trying to see whether or not we can extend our telemedicine. Almost all of them have telemedicine today through Bryan Telemedicine or another telemedicine organization. And so we're trying to see whether or not we can provide some 24/7 monitoring from a distance if we extend some of our pulmonology and intensivist services to that. So more to come on that. I'm going to turn the microphone over to Cliff Robertson with CHI Nebraska now.
Thanks, Russ. CHI Health, like Bryan, has been focused on planning for the future. And for us, that isn't just about Omaha and Lincoln. It is about all of the communities we serve, including the agricultural communities, the rural communities that make up Nebraska and southwest Iowa. CHI Health, our footprint, our clinics and hospitals actually touch about 70% of the region's population. So we take very seriously the role that we play, not only in good times, but obviously in times that we find ourselves in. Like Bryan, we've actually been very focused on working with our rural partners. We obviously set up a helpline, which has been very well received across the state. Over 110,000 folks have visited that webpage and have gone through a process, a triage process. We also are expanding telehealth capabilities, not only our hospitalists and critical care docs being able to assist in the management of patients in our critical access hospitals, but also that our rural providers to be able to deliver care to their practices, their patients, remotely, virtually, without actually having to bring people in to the clinics. We also include our rural partners and our critical access hospitals in our division-wide incident command, which has been set up and operational. So we have a team now that is essentially working 24 hours a day, preparing and planning our response as the situation, the COVID virus situation unfolds. One of the things that being part of a large national health system provides us is the ability to access resources and expertise from around the country. So while some organizations have expressed concerns about their supply chain being short on supplies, that's not been an issue for us at CHI Health as of yet. Every day we monitor it, we measure it, we're obviously doing everything we can do to conserve supplies, but our critical access hospital partners have access to the larger resources of not only CHI Health, but Common Spirit as well. The other thing we've been working on, and it's been our privilege to really work closely with the Chief Medical Officer of the state, is creating surge capacity above and beyond what already exists in our hospitals today. And so we have been working with the state of Nebraska to put together a proposal and a plan to open a unit at St. Elizabeth's as well as an ICU at our Midlands Hospital in Papillion to be able to absorb additional COVID-19 patients should that be necessary. The reason I'm going to emphasize should it be necessary is Russ had noted, we've all begun to reschedule elective surgical procedures, push out surgeries that can be safely delayed to create capacity within our existing hospitals. And I can tell you that across the state, CHI Health, as do all of the other hospitals, have capacity to admit and care for patients that are infected with this coronavirus. So more to come. We can speak specifically to ventilators and other equipment, but rest assured that health systems like CHI Health, like Bryan Health, like our partners in Omaha are actively preparing for a worst-case scenario, while we, though, are believing that the actions that our state has taken, the leadership that our governor has given in terms of making some hard decisions, but making them early, we really are hopeful that we may not see the same impact that places like New York are seeing today. We're not out of the woods yet, but I would say on behalf of CHI Health, we commend the state and the state's leadership for acting fast and early and decisive, because we do think that'll make a difference. Governor?
Thank you very much, Cliff. Folks, you see right there why we are going to beat this virus. I can't tell you how proud I am of our healthcare workers and our hospital systems here in Nebraska. I mean, think about what you just heard here today. The innovation going on at Bryan Hospital, how somebody said, hey, we got these ventilators from anesthesiology. We can convert and use them in case we need them. The innovation at Midland to say, hey, we've got some hospital beds available for a relatively small investment from the state. We could actually make those operational. You know, that's how we are making sure that we can expand the capacity to be able to take care of the people who will need our help when they're impacted by the coronavirus. And folks, that's what this is all about, is when we're talking about this idea of physical distancing and the 10-person rule. What it's doing is giving us time to be able to put the solutions that systems like Bryan and CHI have the ability to do if they have the time to do it. So that's what this is about. It's about making sure that we spread this virus out so that we can take care of those folks. And you can see how our hospital executives are working with their teams to be able to do that. And again, when we're talking about, for example, putting off those elective surgeries, what that does is it takes an operating room and now allows it to become an ICU room with that ventilator. And it also preserves that personal protective equipment that everybody is talking about how they're short of, except for CHI, because they got a bunch. But the point is, that's helping conserve that PPE that we need here in the state. These are the types of steps that our hospital systems are taking to be able to make sure they're prepared to meet the demands for the people who have coronavirus. And I can't say enough about how proud I am of the work that these CEOs and the teams that they're working with are doing, and all of our healthcare systems across the state, to be able to make sure we're prepared to be able to do that. It really is great work. And obviously, we are going to continue to be partners with them through our chief medical officer. We've started phone calls to be able to make sure we got good communications going on. So this is part of how we are getting prepared to be able to deal with the coronavirus as we see more tests. And now, actually, that's one of the things I do want to hit upon before we move on to Ag Week is we're expanding our testing capacity. What the people of Nebraska should expect is that we are going to see more cases test positive. As we expand our testing, and I told you about the 100, we crossed the 100 line of the private labs yesterday, and as we expand our testing in the public health lab, as we do that, we will see more people get tested positive. That's nothing to be concerned about. We want to find the people who are testing for coronavirus so we can make sure we have the best data available. But as you can see from what the hospital CEOs here are talking about, is as we're expanding our testing, we're identifying more people, and as we have more people who are going to have the serious conditions that need that hospital care, we are also working to be able to expand that capacity to be able to take care of them. So again, we will see more people test positive as we expand testing. People should not be concerned by that. That's what we would expect to see happen. As we test more, we will find more. So with that, I'd like to now move into Ag Week that I talked about before. Again, our farmers and ranchers feed the world, and they are the best in the business at doing that. I want to thank them for all their hard work and all the things they are doing to make sure that we keep a strong food supply chain here in Nebraska. That's one of our responsibilities here in our state, is to make sure we continue to have that strong food supply chain to feed the rest of the country and the rest of the world. So in a moment here, I'm going to call up Steve Wellman, who is our Director for Agriculture, and he's going to talk about some of the things that we are doing in the Department of Agriculture to make sure that we can continue to do that. And in the meantime, I just signed a proclamation proclaiming it Ag Week here in Nebraska to recognize our state's #1 industry and all that it does for our state and our great nation. And with that, Steve, can I ask you to come up and say a few words?
Well, thank you, Governor Ricketts, for proclaiming today as Ag Day here in Nebraska and National Ag Week. So, good afternoon, everybody. First of all, happy Ag Day. Agriculture means a lot to the state of Nebraska. It means a lot to me personally as a producer. It's what I've done my whole life, and our family's been involved in it for multiple generations, like many of our farmers and ranchers throughout the state of Nebraska. So first, I want to address a little bit about Department of Agriculture and what we are doing in response to coronavirus, and really our focus in the department is two things. First of all, our teammates take care of themselves, take care of their families, take care of each other. Our roles at home have probably changed recently. So we want to make sure that we're focusing on those family needs, the family matters, our individual needs. Stay healthy, take care of each other, but then continue to serve the state of Nebraska and do the duties that are responsible for really helping Nebraska agriculture continue to do what they do every day. Now, in serving the state of Nebraska and serving what our needs are for agriculture, it basically comes down to the criticality of agriculture production, agriculture transportation, and processing. And our role at the state is to do the critical aspects of that, whether for interstate commerce, testing, transportation, and really just keeping the materials flowing back and forth so exports continue, so products can get to processors, and processed products can get to the consumers. Those are critical to the state, they're critical to the nation, and they're critical to feeding the people around the world. Now, in regards to COVID-19 and how it relates to agriculture, the measures that Governor Ricketts has talked about and brought up again today, really what that means to me is biosecurity. Farmers and ranchers in Nebraska, we understand biosecurity. We practice it every day. We practice it with the grain that we produce. When we harvest it, transport it, store it, we watch for contaminations. We work to prevent contaminants in the grain. On the livestock side, we've had, at many facilities, has been shower in, shower out for years. We've taken precautions for livestock to keep them healthy and to protect them and protect ourselves as we operate that every day. So I think agriculture understands the biosecurity part. I think the one thing that we can probably do better is to make sure we apply it to ourselves in the conditions that we're operating in now. Agriculture wants to be a solution. We want to be helpful, and I think when we take this back home, we need to practice the social distancing and those types of things in our rural communities, at home, and do those types of things because we understand the criticality of that and the need for it. Last thing I will say is thank you to our farmers and ranchers for what they do every day, for the food, the feed, the fuel they produce for us day in and day out. Our state is very blessed to have multiple resources, our land, our water, but most of all, our farmers and ranchers that carry out the work every day. And now I'm going to turn this over to Steve Nelson with Farm Bureau with a reminder for our producers. If they have issues, if they have concerns, make sure they reach out to our farmers and ranchers organizations throughout the state. They're great advocates for us. They're in contact with Governor and myself and whoever they need to be in contact with to represent the people that are carrying out the work every day. So again, stay in touch with them. And Steve Nelson, please take the podium.
Well, good afternoon. Thank you, Director Wellman, and thank you, Governor Ricketts, for your leadership. The leadership has been talked about a lot here today and how important that is as we deal with this very unusual situation that we have in our state and nation and around the world. And so I appreciate the work that the governor has done in leading in this process, because it's very, very important. At Nebraska Farm Bureau, we're doing a number of things related to the coronavirus, and I'll talk about those. But first, I want to say that for Nebraska farmers and ranchers and for farmers and ranchers all across our country, every day is Ag Day, every day is Ag Week. We're very proud of what we do on farms and ranches here in the state and around the country as well. And so the opportunity to celebrate the fact that agriculture is so important to really everyone is something that's very special to us. So thank you again, Governor. One of the things that we've done at Nebraska Farm Bureau is we've put together a communication to our members that talks about some of the things that farmers and ranchers might be thinking of as they look to deal with the situation that we're in. So we've talked about the personal hygiene issues that have been shared earlier this afternoon, that those are important, that the social distancing is important. In some ways, in certain areas of the state, social distancing is not that hard, but we all have businesses that we deal with. We need supplies. We're delivering products. So it's important to think about how we do that differently under these circumstances. And so we've talked about that. We've also been working to make sure that the supply chain to farmers and ranchers is something that will work as we work our way through the calving season this year and work through the planting season, where in both cases timing is very critical. So we're trying to look ahead and anticipate any disruptions that might take place in any of those areas. Then I'd like to say that as I've talked to farmers and ranchers across the state since the recognition of the seriousness of the coronavirus, there's a significant dedication to making sure that we do what we do. We're at the beginning part of the food production system in many, many cases. So the grains that we raise, the livestock that we raise, the other things that we produce on farms and ranches, it really begins in rural areas, in rural Nebraska, and those items that we grow and produce are what end up on a grocery store shelf at some point. And so, as Director Wellman talked about, all of the things that happen between what happens on the farm and what happens and it gets things into the grocery store is extremely important, and we appreciate all the work that you've done to make sure that those processes continue to work. Lastly, then, Nebraska Farm Bureau will be hosting a teletown hall this evening, and that will be primarily with our leaders, but the access to that would be available by going to our website as well. What we're going to do tonight is really listen to our members, listen to their concerns, learn about any disruptions that might be happening on their farms or ranches, and make sure that we're working as hard as we can on their behalf. So as Director Wellman talked about, the importance of letting people know if you're having trouble with something is a very important thing, because we can make sure that we try to address those issues as fast as we can. And then tomorrow at noon, we'll be doing a Facebook Live event with Dr. Gold to talk about in greater detail the health care aspects and the potential for spread and those kinds of things. That will be an opportunity again for our members to ask questions, and that will be recorded. We'll be able to share that so that people that have questions or interest in that aspect will be able to access that information at any time. So again, thank you, Governor, for the proclamation on for Ag Day and Ag Week. Very much appreciate again your leadership and yours, Steve. So thank you very much.
All right, well, Steve, don't go too far away. I want to just give you the proclamation. So thank you very much for all the things that you and your members do on behalf of agriculture and make sure our great state and nation stay fed. Thank you.
Thank
Thanks.
you, Governor. Thank you.
All right. So appreciate both of you and what you've talked about for Ag Day. Now we're going to go ahead and open it up to questions and answers. And as usual, I've got the questions that were submitted ahead of time. We'll hit first. So from Chris Dunker, Lincoln Journal-Star, Several readers have reached out to say their employers aren't taking appropriate action when it comes to observing social distancing or making adjustments like curbside service to prevent the spread of the virus, even if several employees or customers may be at high risk. Is there anything employees can do if they feel their health may be at risk from their employer? With regard to this, first of all, I want to start off by saying, again, we are not shutting down businesses here in the state of Nebraska. We are asking businesses to comply with the 10-person rule if they have large groups of public who visit their establishments. So again, in Omaha, we've issued a directive health measure, which means that restaurants cannot have any dine-in customers, bars the same deal, though they can sell takeout, delivery, drive-through, or package goods from a bar. So we're not shutting down businesses broad-based. If somebody, first of all, if you're a manager of one of those businesses, you ought to be reaching out to your teammates, the people who work for you, to let them know what your plan is to deal with the coronavirus. You should be taking those physical distancing things we talked about. You know, the 6 feet on the floor, maybe between your customers, if your customers are in a line, things like that. Employers should be proactive. And to folks who work at those companies, if you feel that you have a problem, you should pick it up with your managers and talk to them, and perhaps even offer them ideas about how they can do a better job with regard to making sure we're keeping everybody in our community healthy and safe. Is the state working to secure more tests on its own or waiting for the federal government? If the state is trying to procure them on their own, can you explain what that process is? So as I mentioned yesterday, we are looking to expand our capacity in the public health lab, and today we are pooling samples, so that shall expand our capacity there. We are working with providers. We certainly appreciate, for example, the work Brian is doing with regard to their new drive-up facility, and we are seeing more private companies, private labs doing more testing through healthcare providers here in the state, so that will expand testing. And we are also working with the federal government to secure more testing as well. So we are pursuing all those channels, and the state is looking to be able to procure more of our own tests as well, even outside what we're doing in the public health lab. We've assigned a person who is responsible for procurement for things like testing kits and personal protection equipment. Doug Carlson is his name, and he is working to find vendors across the country and around the world to be able to supply us with those needs. Second question comes from Paul Hamill, the Omaha World Herald, and a reader question. Has there been any consideration or discussion in the legislature or the governor's office of extending the Douglas County property tax deadlines? Actually, it says March 31st. I believe it's actually due April 1st, or July 31st, which I think is actually August 1st. And with regard to the April 1st deadline, the answer is no, we are not considering that. That is, again, an important source of revenue for our local government. Again, the state does not collect any property taxes. That is all your local form of government that does that, whether it's your schools, counties, cities, NRDs, community colleges. Those are the folks that collect your property taxes. In our opinion, it is too disruptive to make that decision without analysis and input from those local government entities, and April 1st is just too soon for us to be able to do that. We may review that again when we're coming up on August 1st, but we're not going to do it for April 1st. And then I actually think I had a question. Didn't we have Joanne Young ask essentially the same question from the Journal Star? Maybe I just put that over. Oh, here it is. Here's her questions. Never mind. Joanne Young, has the governor given any thought to delaying the first half property taxes? Again, we just covered that. The answer is no. Yeah, well, I've given thought to it. We're not going to do it. Is anyone considering a plan to get nonviolent inmates out of prisons sooner as the crisis heats up? I want to be very clear with folks in our correction system that we don't have, I mean, there's a misperception out there. There's a lot of nonviolent folks in there and a lot of folks who are ready for parole. That's just not true. It's simply not true. We can give you the numbers to show you what the inmate population looks like. So, no, we are not going to be letting anybody out early. The parole board will continue to work their process with regard to parolees, but we're not going to do anything with regard to that. We do have a continuity plan in place for our correction system, and we will implement that as it becomes necessary, but we're not going to be letting a lot of inmates out ahead of their schedule. The answer to that is no. Has the governor been tested for COVID-19? So I don't fit the profile of anybody who would get tested. I'm not symptomatic. I haven't been to Europe or Asia anytime recently. I haven't been to Seattle or New York or San Francisco anytime recently. So I would not fit the profile for somebody who would be tested, and I have not been tested. Taylor, do we have any other questions that have come over text? Okay, great. So now I will take questions here, and of course, you can direct them to any of our guests that we have up here as well. Yeah.
We had a viewer call in kind of looking for guidance for small business owners like hair salons and nail salons. Kind of what should they do? They're practicing their 10-person limit, but they can't really practice that 6 feet social distancing.
Sure. Again, the question was about, what about nail salons and hair salons? And you've said, keep 6 feet of distance between you. Again, what they ought to be doing is paying attention to the 10-person rule, which you mentioned they were, no more than 10 customers in there, and we're not trying to shut down business. We understand that some businesses involve being very close to a person. That is fine, because what our orders are really about is preventing large public gathering. That's what really when we put together our plan several weeks ago with the expert unit at UNMC, what this was all about is really preventing those large public gatherings where then the virus has a great opportunity to spread to a lot of people. So that's what this is about. Again, I would certainly encourage our folks at our salons and so forth to have good communication back and forth between management and the people who are working there about this. But there's no expectation that they should not do their jobs. Yeah, Martha.
Last night, the president talked about Nebraska, mentioned you by name, and said that Nebraska is among the states that's lightly affected, and that perhaps we would be able to get back to business sooner rather than later. And do you agree with that assessment?
Well, again, with regard to the president's comments last night, he did say that Nebraska had been more lightly impacted than other parts of the country, and we can certainly look at parts like New York and so forth. I didn't actually pick up the connection between that and getting back to business sooner. And again, what we're going to do is continue to take the necessary steps to limit those big public gatherings, because that's the way we slow down the spread of the virus. And every state's going to be different with regard to this. So we will continue to practice those measures. We're going to continue to consult with the experts like we have at UNMC, and our public health people will stay in good communication with them, what they're seeing in their regions, and we'll make determinations about when we can start loosening up some of these restrictions when we think it's appropriate.
Governor, in regards to your quarantine rule, is this people that have traveled to some of the bigger cities or internationally in the last week, last few days, last few weeks? Do you have any guidance on that?
Sure. What we're talking about is anybody returning to the state of Nebraska. Our guidance was actually already out there, so this goes back, how far back does this go, Dr. Antone? When did we first publish that? 2 weeks ago?
Mid-February or early February.
Yeah, so February. So we actually put that guidance out in February. So anybody who's traveling, who has been traveling at all in any of these places, immediately, if you come back to the state of Nebraska, if you came back last week and haven't been doing it, start doing it. So if you came back 2 weeks ago and you're still within that 14-day period and you haven't done it, start doing it. So it applies to anybody who's traveled outside the state of Nebraska to Europe or Asia or to any of those big cities where they have the community spread like New York or Chicago or San Francisco, LA, Denver. Those are the kind of places we want people to make sure you're quarantined.
Governor, we had a
Oh,
viewer
yeah,
call in
yeah.
asking if there's been any more discussion to postpone the Flint Hills controlled burns as it could affect Nebraska's air quality.
We have not had any discussions with the state of Kansas with regard to the Flint Hills burn. That's something that's necessary. They do every year. We'll certainly, see what happens with regard to once they start that, as we always do. If it seems to be unduly impacting us, I have in the past, for example, reached out to the state of Kansas. But that's also a necessary thing to do to prevent the growth of invasive species. And frankly, if they allow that to build up over time, it becomes its own hazard, right? Start threatening life and property in Kansas through wildfires. So we got to remember all these things have trade-offs, and we try to judge it as best we can to balance those trade-offs. But at this time, there's no plans to reach out to Kansas about that because it hasn't been impacting anybody here. Fred?
Question for Director Wellman.
Sure.
I'm sorry, this is a city kid question, but
Yeah.
what are the risks farmers are getting ready to plant? If they themselves are infected, or can seeds carry the virus? Cattle move around. What are the various things that you're watching for?
So the question is, what's the risk to the farmer and rancher and what may carry?
Food supply chain.
Yeah. Dr. Antone can probably answer the connection between the carrier and the producers much better than I can. My comments are really, farmers and ranchers are used to carrying out biosecurity measures for the protection of their livestock and the grain that they produce. So I think they understand the concept of it. my point is for the farmers and ranchers themselves to make sure that they take the precautions to protect themselves as described by Governor Ricketts and by the CDC guidelines. And really, don't forget just the basic health concerns too. Get enough rest, eat well, stay healthy, so you can continue to go to work the next day. And I've been there. The springtime gets crazy and really busy, and sometimes farmers and ranchers could probably do a better job of taking care of ourselves. So in this time of really concern for COVID-19, I think we really need to remember also the basic health requirements that we need so we can continue to do our job.
Livestock carry the disease.
Well, it's actually Dr. Anton, come up.
I can't really answer your question about livestock in particular, but I know people are been concerned about their pets. So that's the best answer I can give you.
Dr. Anton, my understanding is that dogs cannot get the coronavirus.
Okay.
Is that accurate?
That is,
There's been no proven case of any animal having it?
I have not heard of it yet, no.
I should say any of our livestock animals?
Yeah. But I'm glad Director Wellman asked me up here because I just want to say a few words about Russ and Cliff and his team and how great it's been working with all the CMOs and the CEOs of all the major health systems here in Nebraska and the Omaha area. They did a lot of these things on their own without us even asking, shutting down elective surgeries, preparing for their ventilators. And it's also been the other health systems too. I've been in close contact with the University of Nebraska Medical Center and with Methodist Hospital and also with the Midwest Surgical Hospital. And they've all been getting together to work together as a team. Only in Nebraska, I think, could this happen, where everybody just volunteered this. And I can't thank them enough for doing this. It's made the state's role so much easier. So I just wanted to say thank you to all those people.
You said no dogs.
Yeah. I so far have heard of no pet transmission, except people are worried about it, I know, and they call in for it.
And Dr. Wellman, you've got the state veterinarian in your department. Is that person
Correct. So, and I was,
getting any additional information?
yeah, so we've talked about that. I mean, we are not concerned about coronavirus infecting our livestock and creating any issues with our food supply. We are not concerned with that, so let's be clear there. So we are not concerned with it passing from the humans that we're all talking about today and COVID-19 and any impact to our animals and our food supply.
I do have a question from Bill Shammer at 1011. What about airports? If someone wasn't in a hot zone, but got stuck in O'Hare or another major airport, should they quarantine?
So the answer was, or question was, if somebody was, say, traveling through O'Hare and they got stuck there, should they quarantine? The answer is yes.
We also have a question from Nicole at Fox 42. She wants an update on the potential evictions moratorium. The Omaha mayor released a letter today asking landlords not to evict people. Do we know yet whether the state has the authority?
As I said yesterday, we're still reviewing the issue with regard to evictions, and so I would say don't have any new news for you today, but continue to monitor it as we complete our research on it. We'll make an announcement.
Any kind of increased concern for maybe pregnant women and their unborn children at all?
Well, as we have said, that coronavirus presents a special risk for people with underlying health conditions, and pregnant women actually fall into that category. So certainly if you are pregnant, you should take more precautions with regard to all the things we've talked about. Really make sure you're staying away from people who are sick. Really staying home is going to be a good idea if you are pregnant. There's no specific risk that I know of with regard to coronavirus, but just in general, when we're talking about underlying health conditions, being pregnant can suppress your immune system, and so it does put you in that category of people we say, hey, you're at greater risk, so please take care. Martha.
Could you or someone else explain the idea of pooling samples, what that is, and then also review who now is eligible for being tested?
Sure.
Since you've expanded that?
Sure. So while we've expanded testing, we have not necessarily expanded the criteria for who is going to be tested. That will be something we phase in. But broadly speaking, again, what we'll do is if you are symptomatic, so you have a high fever and coughing, something like that, we want you to stay home. First thing you do is go home, stay home. Contact your healthcare provider, make an appointment to go see that person if you are concerned about having coronavirus. And then they will make special arrangements to see you. They will test you for influenza A, influenza B, and a respiratory panel. And if you are negative for all those things, and you have been to Europe or Asia or one of these high domestic areas we've talked about, the big cities, Denver, Chicago, New York, been one of those places, you're going to be at high risk, and you will be a priority to get tested. As we expand the capacity, we will start doing healthcare workers, our first responders, police, fire, EMTs, and then our folks in our nursing facilities. Again, people who are either dealing with the public or going to be at greater risk. Now, the idea of this pooling means what we're going to do is we'll get samples from everybody who we're starting to test, right? So you've heard about the nasal swab. It goes into a test tube with viral medium or saline, and that gets sent off to our lab. What we can do, and again, the idea is we're looking for the genetic material of the virus to determine if it's there. Instead of taking each one of those test tubes and testing them separately, we'll take 5 of those test tubes and put it into one and test that one test tube. And if that one sample comes back negative, we know all 5 of those were negative. And so we have just saved 4 tests. Now, if that test comes back positive, then we will have to go back and retest all 5 of those again to figure out which one of those was positive. So it's a way of really kind of narrowing down our tests. But right now, as Dr. Antone, I think you mentioned yesterday or the day before, even with all the high-risk people we're testing, right, 95% are coming back negative. So only 5% are positive. So you can see that if you're pooling these samples, you will, on balance, not have to retest them very often. You'll much more often determine all 5 are negative, and therefore you will have saved all the reagents from those 4 other tests you don't have to do because you know all 5 are negative because no genetic material for coronavirus showed up in your one test sample. Does that make sense?
Governor, last week, I believe you said 200 tests a day was the capacity of Nebraska. What is Nebraska at right now? What are you eventually looking to get to?
Well, at our UNMC, we're still at about 100 a day. With our lab, again, you can see the way I just described this, that will take us up over 400 a day capacity. And then with the private labs, again, we just got 100 yesterday. So you can see that capacity is growing. And again, we are working through our own procurement to buy more test kits. We're working with the federal government to get more test kits. And of course, as the private laboratories come online and health systems like Bryan work on their drive-through, we will see more testing capacity come up that way as well. Yeah, in the back.
Speaking with the drive-through testing, is there any other sites, excuse me, besides Lincoln, that are planning these drive-through testing?
We don't have any other testing drive-throughs. Nobody, they didn't jump up and down, so I don't believe we have any other besides the one at Bryan planned right now. But again, as we expand testing capacity, that is one of our plans to be able to do at the state as well. Yeah.
You talked about hot zones, New York and all those kind of cities. Should people be concerned at all about Douglas County? They have the most cases so far.
Actually, if you look at Douglas County, they certainly have the most cases, but relative to those other big cities like New York, we are nowhere near the number of people that have the coronavirus compared to New York City. So again, you want to make sure you're doing all the good social things we talked about, that physical distancing, washing your hands, do all that sort of stuff. But be careful when you're going out, but you do not need particularly concerned in Douglas County compared to, again, New York is definitely a place where I would not recommend anybody going right now. Yeah.
Yes, so yesterday you kind of mentioned that Nebraska wasn't in a position to issue any stay-home mandates, but now you're saying that you expect more positive cases to come out with more testing. Does it get to a certain point where you do at least consider a stay-home mandate?
No, we will not need to consider that at all. Again, our plan we put together is not about having people stay at home. It's about avoiding the large public gatherings. That is really where the coronavirus spreads, is when you have a bunch of people come together. So we have taken the most restrictive steps we are going to take in the Douglas County, Cass County, Sarpy County, Washington area with the 10-person rule that is in force until April 30th, with schools being closed down. We've got, again, hospitals are preserving their PPE and getting ready with their, discontinuing elective surgeries. All those sorts of steps and all the things we've asked people to do with regard to restaurants and bars, those are the steps we're taking. We do not need to do what some of those other states have done because we have put this plan in place with the advice of our experts at UNMC. We've implemented it far in front of where New York is much further, for example, in the progression of the virus in their community than we are here in Nebraska. We really are much earlier in that cycle and have put those things in earlier than places like New York.
So just to kind of clarify, even with more positive cases coming out, we're still sticking with the 10-person limit?
Yeah, absolutely. So again, what my point was, as we do more testing, we should expect to get more positive cases, and that's nothing to be alarmed by. We know there's more cases out there, and again, some people, in fact, I just heard one news report that said the majority of people may not even know they're symptomatic, or may not even be symptomatic. So again, we know there's going to be mild cases out there. We are going to try to, again, prioritize the people like the healthcare workers and first responders, but we know there will be more cases out there. That people shouldn't be alarmed by that. What they should do is make sure we continue to follow that 10-person rule so that we can slow down the spread of the virus here in our state to make sure we don't overwhelm our healthcare system.
Governor, do you know, are any schools, either public or private, still open at this point?
The question was, do I know if any schools, public or private, are still open at this point? To my knowledge, no, but that's a great question for Commissioner Bloomstead, who's our education commissioner. He would have a better answer for that than I would. Off the top of my head, I don't know of any, but Commissioner Bloomstead will have a better read on that than I will.
Governor, have you given some thought to the election, the primary election, which will be coming up, and whether to move that or try to do it by mail or make other changes?
Yeah, we're not, I think at this point, we're still considering our options with regard to the election, so I don't have anything to announce on it at this time. Okay, I don't see any other questions. Last call for questions. Okay, again, folks, thank you very much. Very much appreciate you taking the time to be here today. I want to thank all Nebraskans who are working so hard to prevent the spread of the coronavirus here in our state. We will continue these weekday press conferences at 2 o'clock to keep all the folks in Nebraska informed. And you'll continue to see what great work some of the folks around the state, like our healthcare CEOs, Russ Grunwald and Cliff Robertson, are doing, what agriculture is doing, Steve Nelson at the Farm Bureau, the great work our team's doing here at the state of Nebraska, people like Steve Wellman and Gary Antone. We really have a fantastic team that is working to keep Nebraskans healthy and safe. Thank you all very much, and remember, wash your hands often. See you tomorrow. Thanks a lot, Steve.